Hi everyone, our presentation is on the deathbed phenomenon. It's by Mariah Madrid, May Pearl Cornelio, Veronica Miller, Carmen Pena Hernandez, and Amy Tafoya. Just to begin, I want to talk about this picture that we put on the first slide. We liked it because it showed that there's a lot of things going on in the patient's brain at the time of death. Just to give you some insight, this is why we need to be open to hearing what the patients have to say and listen to what they are saying instead of categorizing it as something else. We have a few presentation objectives. The first one is to explain the deathbed phenomenon and when it occurs. Second, discuss common themes found in research that relate to the deathbed phenomenon. Third, discuss the medical explanations for the phenomena. 4, discuss the role of the nurse who is taking care of a patient with this phenomenon. And the last one, provide examples of how the nurse can have a conversation about deathbed phenomenon with the patient and or the family. These are our roles within the presentation. Mariah worked on the deathbed phenomenon introduction. May did the themes in research. Veronica did the medical explanations. Amy did the role of the nurse, and Carmen did examples of communication.
Hello, this is Mariah, and I'll be doing the introduction to deathbed phenomena. I'm going to explain what deathbed phenomenon is, when it occurs in patients, and an example such as deathbed visions and communication. Deathbed phenomenon includes visions, dreams, hallucinations, and premortem energy surges, which is one last surge of energy that may seem like the patient is doing better. However, all these things can be deeply spiritual experiences for the patient. This is why spiritual care is an integral part to multidimensional palliative care. We are going to explore how the last hours of life are sacred as holistic, and how multidimensional practitioners and nurses should remain open to these experiences that are not easily explained within the traditional medical model. It is often seen that deathbed communication between the patient and their deceased friends and family occurs within last days of dying and may encompass auditory, visual, and kinesthetic communication. Kinesthetic communication is body language or nonverbal communication. This may be conveyed as gestures, posture, the eyes, and body movement. These types of things are things that families may notice are different about their loved ones. This is part 2 of the introduction. As I had mentioned in the last slide, kinesthetic communication is often seen as nonverbal communication, such as intentional reaching out of the hands toward an invisible object or person in the room, like the picture in this slide. In an article called Seeing the Light End-of-Life Experiences by Wohilian, it explains how important that the most consistent caregivers, such as nurses, assess, recognize, and validate such experiences to assist patients in finding meaning, comfort, and a peaceful end of life. These types of experiences typically occur within the last days or hours before death. An example of deathbed phenomenon would be a vision which had been reported to be deeply meaningful, bringing comfort and peace and reassurance to the patient. These types of visions are intensely personal and powerful. Visions are often different from person to person, but some visions included animals, such as horses, that would signify that their time had come. Many other reports of deathbed visions have been of deceased relatives, friends, and dreamlike visions that may include religious figures and other types of meaningful things.
So now I'm going to go ahead and describe some of the themes that were found in research. According to the Systematic Review Journal article, Deathbed Phenomena Reported by Patients in Palliative Care, Clinical Opportunities and Responses by Devery K., Rawlings D., Timon J., and Damerel R. This systematic review was done in 2015, and some of the common themes that they found were the phenomenon described where patients and proxies were all kind of similar. The patients were commonly seeing deceased relatives like mothers, siblings, uncles, etc. Some would see religious figures like God or Jesus or even angels. Others would also see beautiful places, kind of like beautiful scenery or like an outdoor environment. Others would also see animals such as horses or even butterflies. During their research, they found that there were no frightening or terrifying experiences from the patients. Another theme that they found similar was timing. Most of the patients reported deathbed phenomenon experiences in the last 24 hours before their death. Some did experience these phenomena a week before death, but majority of the patients experience the experiences within at least 12 hours of death. Now, the third theme that they found were based on the patient and proxy responses. The responses to the deathbed phenomenon is primarily meaningful. It brings peace, comfort, and reassurance to the patient. This is kind of seen as a way for patients to prepare for death. The study did not report any frightening or threatening experiences. However, some could see the experience as distressing. The responses of the healthcare professionals were also a theme that they found. The phenomenon is not discussed by the healthcare team as often due to the lack of training in this area. Patients and or carers were reluctant to disclose their experiences, which leads to underreporting of the phenomena. And lastly, they did not want to upset the patients or caregivers by inappropriately bringing it up. So, because the deathbed phenomenon experiences were underreported by the patients, the hospitals were not training nurses to talk about these experiences to the patients, and it is not that common, and it is kind of hard to talk about these experiences with others, and that is why they tend to keep it to themselves. Okay, to continue with the themes in research, the fifth theme from the research that they did was the occurrence of the phenomenon. They stated that in all 8 of the studies within the systematic review, deathbed phenomenon is pretty common. Both male and females reported having seen these experiences. And lastly, the deathbed phenomenons are neither culturally nor geographically confined and cannot be explained by religious beliefs. Studies have been reported in areas like Eastern Europe, North America, India, UK, and Australia.
Research has shown that deathbed phenomena is a common theme in the dying process, although it has had little research done on it. Even when I was trying to do this presentation, I had a hard time finding anything more than just a mention of any of the medical explanations. Often observed as visions, deathbed phenomena are often dismissed, explained away, or ignored by the medical community. The explanations that are commonly used are confusion, biological processes, and chemical changes in the brain. These are related to pathophysiology changes related to the dying organs. Figments of the imagination and hallucinations, and also psychological unrest or struggling. These medical explanations make sense on an individual basis, but they don't explain why these phenomena are so alike. Not every death is the same, but the deathbed visions and experiences are common and similar. Oftentimes, they're visions of God or angels, and family members or friends who have already died. So because these visions are so similar, deathbed phenomena seems to be more attributed to spiritual events instead of medical.
As a nurse, we have a pretty big role within the deathbed phenomenon. So, just to begin, explain to the patient and family that it is a normal occurrence to see visions of dead relatives, religious figures, angels, or anything along those lines. By doing this, we create an open environment and kind of prepare the patient and for the family for what's to come if it does occur for the patient. Next, just listen to the patient, be open to what they experience. Don't try to categorize it as a medication effect or cognitive disturbances, because this will just make the patient feel like they're not valid in what they're feeling. It may make them not report what's going on with them or not want to communicate with the nurse or the family or anything like that. Explain to both the family and the patient that it is generally seen as a peaceful experience. They may feel comforted by seeing religious figures, or especially like relatives of someone they might be excited to see. Anything like that, just make sure that they know it's comforting. Also, teach the family in particular about being open and listening to the experiences of the patient. They may feel scared to hear that their auntie or uncle died and now the patient is seeing it. That might be a scary thing to hear for the family, but just teach them that it's okay. And then finally, I read some research that said that they might experience something negative. This is pretty rare, but I just wanted to mention it. As the nurse, we need to be able to have therapeutic communication. The patient may want to work through it and express how they feel. So we just need to ask open-ended questions like, how did that make you feel? What can we do? Along those lines like that, so that way it keeps the communication open for the patient.
This slide shows some examples of communication between the nurse and the patient and the nurse and the family. The nurse and the patient example is, the patient reports after breakfast she saw her relative that had passed away 2 years ago. She claims that they had a conversation about God and how heaven is lovely. How should the nurse respond to this patient? The nurse can explain to the patient that this experience is natural and to not be afraid. The nurse may also want to use therapeutic communication and ask the patient how they are feeling after this. The example for the nurse and the family is, a patient's sister approached the nurse because she was concerned that her brother claimed to be seeing angels. The sister explains that she tried to tell her brother that the angels are not real and reorientate her brother. The sister seemed upset because she thinks her brother is going crazy. How should the nurse respond? The nurse responds by explaining that this experience is not crazy and is actually a common experience called the deathbed phenomenon. The nurse should also explain that the patient may find angels comforting and it is okay not to reorient the patient. The nurse should instruct the sister to listen and be open.
Next, we're going to play a YouTube video for you guys called Hospice Caregivers Claim Patients Experience Visions of Loved Ones Before Death. It's a news report from nurses who have experienced patients go through this phenomenon. We think it's really great just so you guys can see some actual examples of this phenomenon.
Well, apparently it's been seen in all faiths and in all corners of the world.
Right before Apple co-founder Steve Jobs passed away, he was famously quoted saying, Oh wow, oh wow, oh wow. But hospice workers who've seen thousands of people at the end of their lives say that's just the beginning.
Lauren Daniels says the story of what's waiting.
It's a phenomenon witnessed around the world as a life is nearing the end.
Breathing will change, heart rate will change.
They feel a little unsettled.
Often staring at the corner of the room.
The soul or the spirit of the life force is trying to get going.
But they're not going alone.
Every religious tradition, every wisdom tradition talks about these beings that come to get us when it's time to die.
Unexplained manifestations called end-of-life visions or visioning that are only visible to the patient.
The patient was visioning over at that side of the room, and this little 2-year-old boy said, "Who's that sitting over there?"
At Hospice of the Western Reserve, they say entering a patient's room is sacred space.
I've had a number of patients who will all of a sudden open their eyes like they're startled, get a big smile on their face, take one last breath, and they're gone.
Although they provide unconditional support regardless of a person's beliefs, they've also witnessed countless cases that defy logic.
She goes, "Oh, when did you get here?" And I said, "I'm Dave from Hospice of the Western Reserve. I've been here for a while." And she looked at me and she said, "Not you, George." And I turned around and looked, and there was nobody behind me.
George was the patient's long-deceased husband.
She just kept looking past me and saying, "Oh, you look so good." And then I found out that she did pass away the next day.
They say a parent or spouse is most common. For a man named Ron, his beloved wife, Becky.
He actually pulled himself over the side rail and reached out and made like a hugging motion and then laid back down. And within minutes, he died. He had been waiting for her to come get him.
For another man, it was the family pet.
He said, "I can see, and it's beautiful here. It's beautiful." He goes, "There's animals." And then he stopped and he looked at his son and he says, "Your dog is here." Yeah. And so, of course, now we're all crying, and then it was like probably an hour and a half later that he died.
Skeptics say the visioning's nothing more than hallucinations brought on by drugs or disease, possibly the brain's coping mechanism dealing with death. But Dr. Kevin Dieter says not every patient visions, and those who do are entirely lucid.
Folks that are dying still can have hallucinations, but they are qualitatively and quantitatively different.
If you try to get their attention and you call them out of that, there's like a transition back to this world, and they don't like it.
Because most visions involve people already deceased, even if the patient doesn't know it.
About 2 weeks prior, her son had passed away, and they decided because of her condition they weren't going to bother telling her.
Margaret was bedridden for weeks, then suddenly got all dressed up.
Her sister, Dorothy, walked in and said, "Margaret," she said, "you look beautiful. What's going on?" She said, "Charles came to see me, and he said he's coming back to take me with him." And she didn't know that. He had passed away 2 weeks before, and the very next day she passed away as well.
And afterward.
A lot of times I notice a difference in the feeling from right before they pass away to after they pass away.
For some reason, a cardinal showing up seems to be fairly common. We don't know why they do that, but they do that a lot.
Are you having any pain at all right now?
Comforting loved ones and hospice staff members, sharing their stories to help comfort you.
Just like one of those things that you want to say, wow.
It just gives you such great hope. And you wonder who's coming for you,
Lauren Daniels, Oklahoma's News 4.
In conclusion, the deathbed phenomenon is a generally peaceful event in the near hours before death. The reporting of the deathbed phenomena may be low due to the patients being so close to death and unable to report these events. From a nurse or family standpoint, we need to make sure you are open to what the patient reports and actively listen to what they have to say. The deathbed phenomena is not commonly discussed because the patients don't always feel comfortable reporting these events. They may not want to seem like they are not mentally present or that they have something wrong with them. We as nurses can help create an open environment for them to report these events, especially if they want to talk about them. This picture sums up our presentation. The saying, "You may have some visitors when it's your time to go," is something to keep in mind for both yourself and your loved ones. Thank you for your time in watching and listening to our presentation on deathbed phenomena. We as a group hope that you learned something and that you can carry this with you through your life.